Hi everyone, my name is Ariane Kalingo. I'm a former beauty queen. I was Miss World Philippines 2016, first princess to Catriona Gray, and now I'm a consultant with Leap Finance based in Singapore. So today I'm getting a V-lift, and I think this is going to be lifted here. My jawline is my concern. I have always had a huge jawline, so I want to make it appear a little bit slimmer and also lift my face more as well. Today I'll be getting the MASJ Perfect V. It'll make this area look a bit slimmer and get it lifted. Specifically, I'll be getting my jawline fixed because this is my concern. I feel pain quite easily. I'm a bit scared about the injections. However, I've gotten injections before from Doc Contessa. The process is very smooth, and she's also she treats me in a way that really calms me. So she explains everything in detail, and I feel very confident with the procedure today, and I really trust Doc Contessa as well. For me, a personalized beauty treatment means getting advice and seeking input and guidance from a trusted doctor, which is why I have always trusted Doc Contessa since 2015. I've been going to Doc Contessa and CSA Aesthetics. Also, I think that getting personalized beauty treatment is great because it instills me with self-confidence, it boosts my self-esteem, and I'm ready to feel that.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we'll be doing a follow-up with Miss Ariane Kalingo.
Hi everyone, I'm very happy to be here.
Yeah. So, the previous week, we did a so-called injection of the masseter using infobotulinum toxin, and then we did also the oil therapy. So the goal was to improve the lower part of the face. So how was it, Ariane?
Well, I was initially scared. However, everything went smooth and you really calmed me down.
Yeah.
You explained the science behind everything, so I really trust you, and I'm looking forward to this next procedure.
Yeah. So today, actually, I'm looking at Ariane. I'm seeing results already. So I noticed that there's already a narrowing of this bigonial wave. Plus, there's a slimming of the lower part of the face. Right, Ariane?
Right. I also noticed a difference when I looked at the mirror. Everything, like this, seems tighter and smaller.
Exactly. And considering that we did the masseter injection only a week ago, we still have another week that it will still become slimmer, narrower. And the oil therapy we just did a week ago. So actually, we still have like a 90-day period that it's still taking effect. So that's the wonderful thing with these kinds of treatments. They will still be giving you more improvements as days pass by. Right. So we're still excited about those. Now, we have another treatment for Ariane. Again, targeting this lower half of the face. But we'll also be combining with another kind of a treatment that will also prevent the sagginess, the droopiness, or the aging. I was looking at Ariane's video a week ago. I was checking on her entire face. I am noticing already a slight sign, a beginning sign of the aging process. So actually I was sharing it with Ariane a while ago. I told you before that we do an assessment following the rule of thirds. So upper, middle, and lower. On the upper third, actually I was checking on the corner of the eyebrow and the corner of the eye. So a minimal, like a beginning, like a tiny already starting to go down there. You notice that?
Yeah, I do notice that there is a sign of aging.
How young are you again, Ariane?
Right. I'm 29 already.
Oh, because right now they're saying, before I was saying 25, you start to age. But I think 20 years old, they were saying aging starts at 20s right now. Right. It's getting younger, right? So I was looking at the corner of the eyebrow and the corner of the eye. So I was seeing some signs of beginning sagginess there. And then in the mid-face section, looking at this so-called OG curve here, we have to maintain that good convexity of the cheek. That's an attractive cheek also. For women, we wanted a very good convexity here, whereby your middle cheek is somehow forwarded, or like it's protruding anteriorly. So on the side, so there's still that good convexity, but we still wanted to kind of project it a little bit more. Because I was looking at the so-called mid-cheek area, there's a beginning sign of a line there. Are you seeing those in your photos?
Yeah, I do, and it kind of makes me sad, so sometimes I have to edit them, but I don't want to keep editing, you know, like I want natural.
So in the mid-face section, in the middle third of the face, you can already see a part of this starting to weaken, okay? There's a so-called zygomatic cutaneous ligament there that over time, it becomes weaker. And when it becomes weaker, your malar tissues will start to go down too. And then the nasolabial fold will start to sag also. So those are parts of the mid-face that you have to observe and then do something about it to prevent the aging process. So somehow I wanted to do a prevention, a so-called lifting technique, to pull the skin upward like that, so that we prevent this mid-cheek groove here and the nasolabial fold there. So that's a treatment that we'll be doing later on. It's exciting, Ariane.
It is, yeah. Everything will be lifted.
Exactly. Because we also wanted to achieve the so-called V shape, right? We wanted to have this ideal face shape. For women, they're saying the ideal is the oval or ovoid shape. But right now, women are wanting the V contour, the V shape. For Ariane, now looking on the lower third of the face, so I was looking at the level of the inferior part of the chin here, going to the side here, the mandibular line here. It's kind of like on the same level. Do you notice that too?
I noticed that in the video as well as in photos, yes.
So because of this, it's creating that shape that is, it's not really the V contour. It's not really that sharp, like the inverted triangle there.
Right.
Okay? So somehow we wanted to reshape it. Of course, we want to do not really alter the looks, but it's more of like making it balanced and following still the proportions there. Because there's this rule on the lower third. The one we follow is the so-called 1/3, 2/3 rule here. So this is like a ratio of 1:2. So we kind of like wanted to a little bit lengthen, but not really the exaggerated one. Okay, still following the proportions, the normal proportions of the face. And I noticed a deep sulcus there. So this one is also causing, if you have a deepened sulcus here, it's causing your chin to like do this forward effect there. So what do you call that, Ariane? It's like
It's a witch's
yeah,
it's going
said,
out, it's projecting.
Yeah, it's projecting, it's going out because of this deepened sulcus here. So we wanted to also treat this part here. We'll improve that. So somehow you just kind of move your chin on this projection here towards, like it's gonna be tilted like that. Okay, and improving the length, the vertical dimension of her chin. It's just a matter of like moving stuff there. Okay,
Right.
we highlight the beautiful parts of the face, we enhance, because you're already beautiful, we're just enhancing. So the goal again is to have that so-called V shape. In a way, we follow the normal proportions. Like when I do my V treatment right now, so considering the center is my menton here. So my menton here, the center here, I follow this and I make a diagonal line from this to the corner of the mouth, okay, going towards that zygomatic prominence there and going to that part of the corner of the eyebrow there. So it's like giving you this diagonal line here. Same thing on the other side there, giving you that diagonal line here, there to give us that very good V contour of the face. So that's our goal, Ariane. So we'll follow this course of line for our treatment later on, and somehow we still have to go within the normal proportions, the rule of thirds, the ratios and proportions. So Ariane, I'm excited.
I'm excited as well.
So what kind of treatment, what product material are we going to use? We'll show that when CSA Medical Aesthetics returns. And we're back. So we're doing a treatment for Ariane whereby we'll be targeting the part of this corner of the eyebrow and also this part of the malar prominence, and somehow I'll also do something on this part here, the nasolabial part here, and later on we'll be working on the chin area. Okay, for Ariane, I'll be doing the so-called bold lift technique using our Radius product. Okay, we wanted something that will be working within the deepest part of our face. It's what we call the structural framework of the face, the bony foundation. Okay, actually aging is not just on the skin layer, Ariane. It's all a multi-layer aging. It starts also within. So we wanted to restore that bony support. Okay, so I have a Radius here. So Radius is a dermal filler that's made up of calcium hydroxyl apatite. Actually, it's made of minerals. Okay, and Radius has been in the market for a long period of time. We've been using it for a long time already, Ariane, and it's been clinically studied. It's FDA approved. Okay, and I think it's Ariane's first time to try Radius. Okay, so we've been doing this for a long period of time already. So I said that we'll be applying a so-called bold lift technique. For bold lift technique, we'll be targeting areas whereby we'll be giving that very good lift of the face. Okay, it's like targeting upper, middle, and lower. It's preventing aging process also, and it will lead to that tightened skin also, a firm skin also. Okay, and I love the Radius also because actually it's one of those semi-permanent fillers, so they're longer lasting. Okay, so my first point of injection will be on the corner of the eyebrow here. Okay, so whenever we do this, we have target points. So here, and I'll be including a bit of the arch so that Ariane will have that good arch of the eyebrow. And then after that, the zygomatic arch here, and then malar prominence, and a portion of the mid cheek there, and this part of the upper nasolabial crease here. Okay, so a while ago we applied a topical numbing cream, a lidocaine, and we left it for like 45 minutes to an hour, okay, just to numb the area. Okay, so I'll start with my first point of injection. This is a so-called 6-point lift. Okay, first part will be this one. So whenever we work on the supraorbital rim, superior orbital rim, we have to avoid the so-called supraorbital foramen there because there is a vital structure here. So I am palpating, feeling for the supraorbital foramen. So it's in this part here. So I have to stay away from that. So on this arch of the brow here, I'll be injecting a bit there, like a tiny prick only, Ariane. And then just a minimal amount to give that lift of the arch of the eyebrow. Like I'll use 0.5 here. It's common for some people that they start to see hooding of the upper eyelid. And one technique to correct that is to pull the skin upward and do an injection on the corner of the eyebrow. My injection point here now will be the so-called zygomatic arch here. I can palpate for the zygomatic arch is at this part. So for doctors, you have to avoid here the so-called zygomatic notch there, where you have a zygomaticofacial artery. So on this part, you avoid the supraorbital because you have the supraorbital vessels and nerve. And here you have to avoid the zygomaticofacial vessel there. So here I'm at the zygomatic arch here, and I'll push my needle there onto the bone. I'm already onto the bone. And then, since you know you're on the bone, it's safe, it's a safe layer, I can inject again a 0.1 to 0.2 in that area. So I'll inject towards the malar prominence. And I can push 0.1 to 0.2 of my product again. So this is another 0.1 here. So after the malar prominence, I want to also improve the beginning mid-cheek line or groove there, or the so-called Indian groove there. And that is also targeting or treating the so-called OG curve, giving that forward cheek or projected cheek, okay? Actually, for younger people, if you look at them on their profile view, their cheeks are like projected anteriorly, okay? You can see there's a good convexity, a good OG curve there. And we'll also treat the so-called beginning mid-cheek line. But again, doctors, you have to palpate for the infraorbital foramen. That's a no-go area here. So that's located 8 to 10 millimeters inferior to your infraorbital rim. Okay, so you palpate and there's your infraorbital foramen. You have an infraorbital vessel and nerve there, so avoid that. So this is now like a no-go zone to me, and I'll just inject lateral or temporal to that and go directly into the so-called mid-cheek line. So towards the supraperiosteal plane, okay, I'm already on top of the bone, and I can inject here 0.2, and you can push up to 0.3. So I am away from the infraorbital foramen. So pushing slowly again, I'll be injecting like a 0.2 here. So again, disinfect. So injecting perpendicularly, so this is a bit sensitive part, yeah, I understand, and towards the so-called piriform fossa. And when you feel or touch a bit the bone, you can push already 0.2 to 0.3 here. So this will be the final injection point for the so-called bold lift technique using our radius. Okay. So I'm done with the right side. We'll proceed to the opposite side. So we're proceeding to the left side. Again, same technique. So I'll work on the arch of the brow here, pulling the skin upward there and towards the bone. It's a perpendicular approach. There's a minimal amount here. So we have done the bold lift technique using radius. Now let's proceed lower third of the face, and we will be treating the center, the chin part here. Okay, for my chin, I make some demarcations there. Okay, so like the corner of the mouth to the jawline there, corner of the mouth to the jawline there. Now the mentalis muscle is in this center part here. Okay, so actually I draw a dome shaped line here. Okay, and I still have to draw a midline there following the center philtrum there and a vertical line. And this is my inferior line. So this lower chin line here. So for Arian, actually, when we check on her rickets line, we can observe that she has already a good rickets line. Okay. It's following the rickets, the tip of the nose, the lower lip, and the chin. There's a good chin projection already. But we were explaining a while ago, we want to correct just the vertical dimension. And the way to correct the vertical dimension is kind of like tilt the chin downwards like that to lengthen it. And we'll be correcting the sulcus here, the deep sulcus here, or the so-called labiomentalis crease. So we wanted to somehow fill in a substance here. So when you fill it in, it will like lead to that lengthening of her chin part there. Okay. But somehow, I still have to maintain that good chin projection. So I don't want to remove that very good anterior projection of your chin. Okay? And this will be part of the so-called Vcontour. So since we have enhanced the cheek region following the Vcontour, we still have to also place product material in the apex of the chin. This part here, in the menton. So menton, and then this part here, the labiomental crease. Now, my technique for Aryan will be the so-called cannula method. For my cannula method, okay, let me just correct this line here. So this is like this. Okay. For my cannula method, of course, the question is, where is your entry point? Of course, we have to do one on the right and one on the left. Now, so I already have a vertical line here. What is my horizontal line? So my horizontal line will be following the highest point of the apex of the chin. So this is the highest point here. So I'll just make a horizontal line there and a horizontal line towards the left. So the line where they transect or intersect, this will be my entry point. So the intersection of those vertical and horizontal lines will be now my entry point. So the cannula method is a safe method for filler injections because the cannula is blunt and then it does not nick any of your blood vessels. Because in your chin region, you have to avoid, if you avoid here supraorbital foramen, infraorbital foramen, you also have to avoid the so-called mentalis foramen because you have arteries, veins, and nerves that come out from this mentalis foramen. So those are structures you have to avoid. And also your facial artery that comes out from the antegonal notch here can also give off a submental artery there. So you also have to be very careful with the branch from that facial artery. Okay, so we're doing the chin. And I've mentioned a while ago, actually, Aryan really has a good chin volume already. So it's a matter of like repositioning that volume and improving that vertical dimension for Aryan, okay? So I'll make an entry point here. I'll pinch the skin, and I have a gauge 18 needle here. Okay, pinch only Aryan in here. Sorry, Aryan. And that's my entry point. And I'll use a cannula that's gauge 25, and it's gonna be directed towards that deep sulcus there, or the labiomental crease there. So we're also improving the apex of the chin. So we've mentioned that we wanted to improve the vertical dimension, and I'll use the same entry point and I'll go towards the chin or the apex, chin apex. So we have done the right part using the cannula method. We will proceed to the left part, entry point left part. So when we're doing filler, we can mold the product, we can massage. So we are proceeding to the left side. So again, vertical line here and the horizontal line there, that's our entry point. Then I'll make a pinch of the skin and make a tiny puncture here. So here is our some resistance when you push this product here. So I'll place a little bit more here in this part here, so we're elongating. Okay, I'm now releasing I pulled out the cannula already, and I think I still have a 0.2 for my balancing. Okay, so we have done our chin treatment for Ariane. So we'll show the result when CSA Medical Aesthetics return. And we're back. So we're showing the result to Ariane. So Ariane, here's the mirror. Okay, there you go.
Wow, I see a difference in the shape. I know that it's swollen right now, but I know that it'll go down. Yeah.
Exactly. So actually, we've used the Radius 2 syringes. Per syringe contains 1.5 cc, and we did the bold lift technique on the upper middle part of the face, and then on the lower third, we did the chin treatment using also a syringe of our Radius. So because we had a cannula method on the chin part, so we expect some erythema and some swelling right now. And then also on the cheek part here, Ariane will feel some discomfort in a little while, but that is temporary because we did multiple injections, so there's some like temporary discomfort. But you can take any analgesic, like if you're not allergic to ibuprofen, you can take ibuprofen or even paracetamol, they're fine. So with Ariane, we will still see more improvements, and we'll be checking on you. We can like actually do a 1 week to 2 weeks check again. Okay, and the goal again is to achieve that like inverted triangle, or rather the V contour. Because I was mentioning a while ago that this part of the lower third, like the mandible angle here and the chin part here, it's like they're on the same level. So the chin part, the center part, we wanted it to be somehow lower, or we are increasing the vertical dimension there. The vertical dimension, not the forward projection there, because we've mentioned that it's within the rickets line already. She had already a chin projection. So the target was in the deep sulcus here and also in the apex of the chin. So some swelling there because of those manipulation. And then so far, we've seen an instant result. We've seen an instant change in the face contour. Right, Ariane? Okay. So anything you would want to share?
I think that this really went smoothly. Doc Contessa really knows what she's doing. She explained the science behind everything, and I'm confident that the results will be really excellent.
That's also important that your injector knows about the science of the product, as well as the doctor should also be very skilled, and all the techniques that were used are like following the safety protocol and the right anatomical injection plate, and also the right material, the right tools, and of course the right patient. Okay. We've done a treatment that, of course, that's really indicated for Ariane. It's more of the enhancement and beautification, and also improving the facial shape, because face shape is important, plus face symmetry is also important, and that is what is beauty. Beauty is harmonious, beauty is proportioned or symmetrical or balanced. Okay, so we'll still check on Ariane. We'll be doing some follow-ups with you. Okay, actually I'm really seeing that contour already, and there's a lifted effect on the cheeks as well as the corner of the brow and the eye. They were lifted. Okay, so we will be showing them some photos like after 3 days, after a week. We can share that with them. Thank you so much. Okay, if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page CSA Medical Aesthetics, Instagram CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please do watch our other videos where we have Ariane. Okay, just look at our YouTube channel, Contessa Salvador. And please do subscribe and click the like button there and notification bell there. Okay, thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.